Welcome aboard Rocket Ship, the platform with the most relevant content for competitive examinations. This is Rocket Ship IAS Lab and continuing with our series on answer writing for general studies papers of civil service main examination. We take up a question that you might come across in GS paper 1. Please read out the question carefully. Universal health coverage is a basic human right. What principles are taken into regard while formulating universal health coverage programs? Critically analyze India's progress in ensuring universal health coverage. On the face of it, the question would appear that it would require you to have some technical knowledge to actually attempt it. But as we go through the answer, you would realize that it's a very, very simple question. It's, to be quite frank, it's an easy question as well. You can have some idea of the key principles that would be included in any, you could say, program that is of universal coverage nature. However, the statistics and examples that we use in this answer script would be of your help. They would make your actual answer quite elegant. That is the real purpose of this lecture. Anyway, as you can see, the second part of the question has this phrase critically analyze. Through this, you can understand we have to talk about not only India's, you could say, progress in making universal health coverage a reality, but you have to also talk about the areas where India has still come short on universal health coverage. With this, we are introducing an answer, that is, we are briefly defining UHC, which means ensuring that everyone, irrespective of their finances and place of living, have access to all their health needs. Now, health is of such fundamental importance that in the landmark Paschim Bang Khet Mazdoor Samiti versus State of West Bengal, Honorable Supreme Court has held health as inalienable to right to life under Article 20. So with this, you can actually understand that healthcare is of such fundamental importance. Then the Sustainable Development Goals, which cover the period 2015 to 30, explicitly include UHC, that is Universal Health Coverage, under Goal 3. That is the SDG Goal 3 is explicitly talks about universal health coverage. Any UHC program should be formulated keeping in principles to ensure it reaches its intended objectives. And so, what are the principles of universal health coverage? Taking them one by one. First is the principle of financial protection, which essentially means that people should be protected against catastrophic healthcare expenditures. What this term means, catastrophic healthcare expenditure, means that there should not be a health emergency that is of such nature that it would compel people to make an expenditure that would adversely affect their finances. Again, to simplify it, what catastrophic healthcare expenditure means that there is a healthcare emergency that is of such nature that people are forced to make expenditure out of their own pocket, and this adversely affects their finances to the point of pushing them into poverty. That is the concept of catastrophic healthcare expenditures. UHC has to specifically protect against catastrophic healthcare expenditure. That is why the principle of financial protection is paramount in universal health coverage. Then comes ensuring quality of health services. Again, we are not going to argue that in healthcare specifically, quality is of quite some importance. Third principle is that of equity and non-discrimination, so that no one should be left behind. Especially the vulnerable sections, the marginal sections, the poor, etc. They should always be included among the, you could say, beneficiaries of universal health coverage. Fourth principle is that of accessibility, that is healthcare all the time and at all the places, that is even the remote places, villages, etc. should have healthcare access. The final principle generally is the principle of comprehensive health system, that is the health system should be robust from you could say the various steps of the hierarchy, that is from primary to secondary to tertiary healthcare. Elaborating on these principles, these points, a Niti Aayog report says that 40 crore people are at the risk of financial ruin due to medical emergency, which is the concept of catastrophic healthcare expenditure. That is, 40 crore Indians actually face this possibility of, you could say, going bankrupt actually due to expenditure for healthcare emergencies. Universal health coverage would ameliorate this abysmal state of affairs by protecting people's finances. This is usually ensured through publicly funded healthcare, health insurance, etc. So these are means to prevent catastrophic healthcare expenditures. Then, healthcare needs are of such nature that ensuring quality care is of fundamental importance. UHC includes quality care as a co-objective. Again, try to understand it through a point. You might have this experience sometime of, you could say, visiting the public healthcare facilities. For example, a government hospital. There the status of hygiene is so abysmal that many people actually catch diseases just by moving to those hospitals, the government hospitals, etc. The UHC has to essentially, you could say, ensure that this does not happen. That is, UHC talks about quality healthcare as well as you could say quantitative aspects, that is covering each and everyone. But at the same time, it has to also talk about good quality healthcare. It is a human imperative that the poor, vulnerable, and the marginalized to have access to a healthy life and their dignity be upheld during an illness. Therefore, UHC focuses on equity and non-discrimination. Again, we might have this experience. I have this personal experience that in the poorer strata of the society in India, I have actually seen people, you could say, suffering due to minor ailments, minor illnesses, because they could not afford the very basic health care. And this is against human dignity. As we have just talked about, UHC has to guard against this, you could say, this wretched condition for these people. It has to actually uphold their, you could say, dignity through providing for an equitous as well as the, you could say, moreover, universally covering healthcare system. UHC ensures that people from remote places, villages, etc. to have access to healthcare as and when they need it. This requires penetration of the health system to the grassroots level. That is, healthcare system should be in the proximity of the people. That is the, you could say, service user. Moreover, without a robust structure, universal healthcare would remain a daydream. That is, a basic structure is again required. It is a sine qua non. Therefore, UHC talks about putting in place a comprehensive health system that includes primary, secondary, as well as tertiary facilities. What these concepts mean: primary is healthcare facility, generally means the facility that is available either at your village level or at your, you could say, locality level. Generally, the secondary healthcare system includes the sub-district part of, you could say, hospital, sub-district government hospitals, etc. And the tertiary facility, generally these are situated at the district level, and they include some basic surgery, some, you could say, greater healthcare needs. That is what tertiary facility generally provide. By all accounts, UHC has to include, by you could say accounts of most scholars, UHC has to include preventive as well as curative care. Preventive care, as you would provide probably understand that both of these concepts, that preventive as well as curative care, they form part of holistic health. The concept of it, sorry, it is holistic, it is holistic, holistic health, the concept of holistic health, where both preventive as well as curative aspects are included. India now, talking about India's progress, India has made commendable progress towards realizing universal health coverage. Let us recall that the PM Jan Arogya or the Ayushman Yojana covers 55 crore beneficiaries. Many more are covered under state government and employee benefits schemes. For an example, those provided by the private sector or by even the public sector units, public sector, you could say banks, etc. Preventive care has seen similar progress with universal vaccination programs like the Indradhanush Yojana. That is, more and more diseases are being covered under universal vaccination schemes. However, talking about some of the areas where universal health coverage program in India has come short, as the previously cited Niti Aayog report says, many lower middle class people who are generally included under the proverbial missing middle are not covered, because actually the Ayushman Yojana covers the most vulnerable, the poorest people in India, and generally the middle or the higher classes, they have, you could say, quite some financial capacity to actually pay out of their own pocket. It is generally the lower middle class which is generally left in the lurch, because it's not covered by the Ayushman Yojana and it does not have the private capacity to pay for expenditure. That is why it has been termed the missing middle of, you could say, universal health coverage by Niti Aayog. Moreover, the quality at public health facilities leaves a lot to be desired. So these are some of the areas where UHC program in India has come short. That is, it still does not cover as many as 40 crore people as the Niti Aayog report itself talks about. Moreover, we can still argue that the quality of healthcare, at least in the public sector healthcare facilities, the public healthcare facilities, is not up to the mark. So UHC, if it has to indeed reach its goal, has to bring these people, that is the lower middle class, to under its ambit, and we have to also ensure that the healthcare that is provided by the government facilities mostly is of good quality. This was all on UHC and its critical analysis of its success, or for that matter, the shortcomings that it has in India. With this, we call it a day. We would reassemble for the next lecture in a few days. As usual, we wish you all the best. Thank you.